Chronic funding gaps and the sudden cut of foreign aid by the United States has left many African countries reeling. So what are they doing to fill the aid gaps? In Sudan, which is currently the world's largest displacement and hunger crisis, more than half the population, or about 25 million people, don't have enough food to eat. The conflict has largely blocked international aid from reaching those in need. And so millions of civilians in Sudan have been surviving on community-led initiatives which draw on the Sudanese concept of nafir, meaning a call to mobilize. They've been a lifeline for people across the country during the country's 2-year war.
We collect donations by urging people and posting pictures and information to try to reach people abroad and help us collect money for Takaya, or community kitchens. The sums of money we get come through Bankak, the banking app in Sudan. And we also have other ways of getting funds. We use the money to get supplies to the Takaya, including coal to cook food, beans, as well as cooking oil.
But the push for independence from foreign aid is not new. In 2017, former President Nana Akufo-Addo launched Ghana's Beyond Aid concept, aimed at putting the country fully in charge of its economic destiny. But critics say it failed due to systemic issues such as tax evasion, lack of a sustained political will, and overall implementation challenges.
Aid will not free us from poverty. It's a vicious circle, and they deliberately leave us into it. So it's important that we see ourselves through our own eyes.
I believe that procrastination has been the problem. I believe that talks and forever theorizing and holding pity parties for ourselves and saying that expecting somebody to come from somewhere to come and solve and solve our problems and assist us, that is where the problem is.
Well, data from the African Development Bank shows that governments spend less than 10% of their national budgets on health, so they rely heavily on foreign donors to fill the funding gap, who are also tightening their budgets.
Africa now finds itself at a crossroads. The health financing landscape has shifted dramatically. To attract grant funding for health, we will have to make a very strong case. And that means contributing more from our own resources and relentlessly focusing on value for money. We should not be daunted by this. The work to build our continent, including our health, cannot be outsourced to anyone else. Current events are therefore an invitation for us to take full ownership of our challenges and find alternative ways of addressing them.
All right, let's hear more from Ashok Swine. He is a professor of peace and conflict research at Uppsala University. He joins me from Uppsala, Sweden. Thank you so much, Prof, for joining us. So straight into it, just how can African countries use aid effectively and stop, not reduce, but stop aid dependency, Prof?
Thank you for having me. I think the Africa in general facing a number of places, huge conflicts, massive conflicts, and those conflicts connected with the climate issues creates a serious food security challenges. And I think this is also in the world is not really responding the amount of food aid or the amount of aid the Africa needs or the world needs. As you can see, even US has stopped giving it. So I think in this sense, the idea is how to find a way that not to be dependent on the international fluctuations of like the whimsical stoppage of aids by the different countries and not priority given to the humanitarian issues. So to find ways of doing it yourself, the people, those who can do it, and the social network within the continent and able to help it. And that's what we are seeing in some parts of Africa, particularly in Sudan nowadays.
Exactly. And we've talked about that, Sudan, and you're saying it. The idea is just how to find a way. So let's talk other African countries apart from Sudan, like we've seen earlier. Are they rising up to the challenge of filling the aid funding gaps?
I think it was a history. History has seen that when the countries, people, or the people of their own clan or the group gets into trouble or that they need some sort of support, the other members have come in. And I think we are going back to the history now in many ways because there have been different challenges. As I said, not only the international aid is not able to come because of the political changes in the countries like US, but also within the country there are various conflicts and the different conflict groups do not allow international aid to come in. So I think in that case, we are going back to a historical pattern that how the people themselves, with some support coming from the diaspora, able to help the people, those who are in urgent need. We are not, despite, talking about Sudan, around 25 million out of 50 million people need urgent aid. There have been around 14, 15 million people have been displaced. But I think we are not seeing the number of the deaths and the way it should be at the food crisis usually brings, because there has been the people are gearing up to support, and they are getting some support from the diaspora, and some of the international aid agencies have also adjusted their aid giving pattern through the help of the local networks.
Indeed. And Prof, Zimbabwe is another successful example because it has bridged donor resource gaps through its 3% AIDS levy that was started in 1999. So what are the alternatives to the donor-led development model that can work in the African context?
I think the donors-led dependency has to go away, not only in Africa, all over the world. And Africa has already started getting that for some time now. It's not a new development because Africa used to be a donor dependent economy in many parts of Africa, as you mentioned, Zimbabwe, but they have different countries, they have tried their own method of getting out of it, and also getting the other kind of international partners being involved. Like involvement of China has brought in a number of ways. We can see the infrastructure development in Africa. The development which has been before, donor-driven development, was only for some sort of food aid, some sort of education on social services. But the gearing of the economy to meet this growing and educated African population, they need infrastructure. They need, huge economic uprising of that nature. So I think that's what's happening. So several countries using their natural resources with the help of the new international support and trying to do, and some of them have been successful and some of them are not.
Indeed. Thank you very much, Ashok Swine, Professor of Peace and Conflict Research at Uppsala University. Thank you for your time and contribution.
My pleasure. Thank you.
Still to come here on Africa Matters.
I am Najib Ahmed here in Mogadishu. Behind me is Somalia's first pharmaceutical factory in over 3 decades, which is now open. And it's doing more than making medicine. I will bring you this story and what it means for families, business owners across Mogadishu.
In Africa's most populous country, Nigeria, there are numerous challenges hampering the country's immunization coverage. I am Ajek Mangut in Abuja, investigating how 2 million children are at risk of catching preventable diseases.
To Nigeria, which is struggling to vaccinate millions of children, many of whom have never received a single shot. Health experts say the country has the highest number of zero-dose children in West Africa. Despite government efforts, insecurity, tough terrain and cultural beliefs continue to stand in the way, as Ajek Mangut reports from Abuja.
Rejoice Kizito says it's important for her 6-month-old son to be protected from common childhood diseases such as measles.
I brought my son to the clinic because I want him to be immune to any kind of diseases in case of any outbreak.
Nigeria carries out routine immunization, which have helped tackle outbreaks like polio. However, despite these efforts, the country still has a low immunization rate.
An estimated 2.2 million Nigerian children have never received any vaccines, according to the Pediatric Association of Nigeria. These zero-dose children make up half of all such cases in West Africa.
25-year-old Safia Husseini's 3 children are among the millions in Nigeria who have not received any vaccines.
The immunization center is far and the road is in terrible condition. I went once, but there were no vaccines available that day. I haven't returned since, and my children remain unvaccinated.
Experts say several factors continue to limit immunization coverage in Nigeria, from misinformation and poor public awareness to a shortage of trained health workers, cultural resistance, insecurity and inaccessible communities. They warn that these gaps could become a problem.
Prevalence will increase. You find that we're not having more children coming in for measles, coming in with things that diphtheria is now becoming another endemic disease. You know, before you hardly see a child come with diphtheria, but now we're having diphtheria.
Experts say the government must take stronger action and implement targeted solutions to close Nigeria's vaccination gap.
There should be public enlightenment, there should be collaboration with all stakeholders, and that means everybody. There should be improved infrastructure in all the healthcare system. Then there should also be incentive for healthcare workers. I think we should now begin to involve local industries or local pharmaceutical companies in the production of vaccine. That may help improve the belief of Nigerians.
Nigeria's government says it is working to get all children vaccinated. It plans to upgrade 17,000 primary healthcare centers and train over 100,000 healthcare workers to deliver essential services, particularly immunization, within the next 2 years as part of efforts to achieve its goal. It's a move experts say could encourage more parents like Rejoice to vaccinate their children. Ajek Mangut, Africa Matters, Abuja.
South Sudan is currently grappling with a rise in cholera cases, and the situation is worsened by limited access and fragile infrastructure that are hampering response efforts. Although more than 80% of the target population has received vaccinations, the mortality rates continue to be alarmingly high. From Bor County, South Sudan, Sheila Pony reports.
Joti Wall could barely remember his name when he was wheeled into Bor Hospital, west of the administrative capital, Juba. At 59 years old and living with a disability, Wall was admitted after experiencing diarrhea and dehydration while out fishing.
Now there's a big improvement in my health compared to when I came in. My condition is now somehow good. The only symptom I am still having is the diarrhea, but other issues like vomiting and body aches are not there anymore.
Between September 2024 and April 2025, the government says it has recorded nearly 50,000 cholera cases and more than 900 people have died from the disease. According to medical professionals here, the majority of these cases come from the fishing communities and villages with inadequate waste disposal.
Bor State Hospital is one of the few facilities handling cholera cases in South Sudan. It's now battling raising cases. Those who make it do have a slim chance of surviving, and doctors say children are the most vulnerable. The biggest problem is reaching here.
See the mouth?
The ongoing violence is making the situation worse. Internally displaced people end up in crowded camps with limited infrastructure.
But, of course, you are all aware of the war in Sudan.
Yeah.
Of course, at first, that was where there was a first outbreak of cholera, and then it was imported into the country from Sudan.
South Sudan's government and Tier Fund, with support from UNICEF, have embarked on a massive vaccination program. Up to 5.2 million of the 11 million of South Sudan's population have already been inoculated.
So we have built 5, basically 3 in Bors House, and 1 in Duke, another one in Twitch East County, because our health, I could say, services are being provided across all the 3 kind of locations.
As cholera continues to claim lives, South Sudan's challenge is not just to contain the current outbreak, but to prevent the next one from starting. Sheila Boni, Africa Matters, Bor County, South Sudan.
To Somalia, where the health sector has been battered by decades of civil war, but it hit a major milestone 2 years ago with the launch of its first pharmaceutical manufacturing plant, built through a collaboration between Somali investors and Turkish experts. The plant is now fully operational, creating jobs and reviving industries. Najib Ahmed brings us this report from Mogadishu.
Somalia's recovery is being shaped by partnership between Turkish experts and Somali investors. One of the most visible investments is the presence of Somalia's first pharmaceutical manufacturing plant, which was set up 2 years ago in Mogadishu. Abdi Hashi, the factory's CEO, says the plant was built to solve a real problem. Somalia's healthcare sector has long struggled with expensive imports and counterfeit drugs. Abdi says Yenisom pharmaceutical plant is now turning that around, producing reliable low-cost medicine locally for the first time in a generation.
The Yenisom plant produces different medicines. This includes capsules, tablets, different vitamins meant for men, women and children. We also manufacture syrups, which are produced in our factory in Turkey, but we are planning to relocate to Mogadishu. In case an unfortunate incident like the COVID-19 pandemic and travel and production is halted, then Yenisom can cover the country's medical needs.
Somalia's federal parliament reviewed a draft law in March 2025 aimed at regulating pharmaceutical to combat counterfeit drugs and improve healthcare oversight. Somalia's aspiration to join East African community industrial development was a critical requirement. Thanks to the partnership with Turkey and re-establishment of the pharmaceutical factory, Yenisom is aiming to revive the medical industry and reduce the pharmaceutical imports. Consumers have welcomed the locally produced drugs, saying it saved them time, lives and resources.
The problem we're facing is we have what you call intermittent. One time they're coming out, one time they don't. Now, alhamdulillah, we're getting better. This country started to open it and the first new factory, Yenisom. We're getting drugs constant right now. Every drugs, we don't have to wait. When we need a drug, we're getting right away, every month.
Turkey's footprint in Somalia is growing. Turkish-backed projects are opening doors across sectors. It's reviving Somalia's economy and building trust in vital services. Najib Ahmed, Africa Matters, Mogadishu, Somalia.
To the Ivory Coast, where cacao farming has supported families for years, but the planned U.S. tariffs have left farmers worried. Despite the temporary suspension, the farmers are concerned that the proposed tariffs will destabilize the local cacao market and increase prices globally. Brenda Radido reports.
For years, cocoa farming has been an important cash crop for farmers in Gatakro village. But for farmers like Bathin Asi Konen, cocoa farming is now becoming unprofitable.
When we make money, we work well and have enough cocoa to export.
But if we are not happy, how can we give ourselves to this work? We can't, because we are suffering. I hire people to come and help me day and night, to clean, to grind. I pay for all of that. And for all of that, the price is not good.
Known as the world's biggest cocoa producer, Ivorian farmers export their cocoa mainly to the United States. But plans by President Donald Trump to impose 21% reciprocal tariffs on goods from Ivory Coast makes things difficult. Although Trump's administration has temporarily suspended the planned tariffs pending further review, there are concerns that its implementation will affect the cocoa industry.
If the United States imposed a 20% tax, exporters will inevitably not be able to export to the United States. And as a result, there will be a problem with increased supply in Ivory Coast. As a result of this, after the supply has increased, our European customers will be forced to buy well.
The proposed tariffs comes at a time farmers are still grappling with the effects of climate change, which has led to low harvest and increased cocoa prices. For instance, the prices of cocoa getting into the United Kingdom increased by 32% over the last 3 years due to extreme weather in cocoa-producing countries, according to the Energy and Climate Intelligence Unit. While in Ivory Coast, the government increased the prices of cocoa in anticipation of low harvest beans due to the extreme weather.
We are affected because we have about 4% of our trade with the United States. This mainly concerns cocoa, rubber, and little cashew. So it is true that we have noticed this increase. In terms of reaction, we must first try to see what new outlets we can find for our products to be able to compensate for this loss.
Ivory Coast produces over 2 million metric tons of cocoa annually. Out of this, over 200,000 metric tons are exported to the U.S., according to the Ivory Coast Coffee and Cocoa Council. Cocoa beans worth $3.6 billion were exported to the U.S. in 2023. But with the impending 21% tariffs on Ivory Coast products, for now, cocoa farmers are nervous about how they will keep their cocoa businesses alive should the suspension be lifted. Brenda Radido, Africa Matters.
As more than 280 million Catholics in Africa mourn and reflect on the legacy of Pope Francis, who will be his successor is also on their minds. Cardinal Peter Turkson of Ghana is already being fronted as the continent's strongest candidate to lead the Catholic Church, as Lara Kilich-Arsalan reports.
For years, the leadership of the more than 1 billion Catholics globally has been dominated by Europe, according to the Vatican. But the late Pope Francis changed that through appointments of more cardinals from the African continent. And for the first time in history, fewer than half of those given a vote will be European. The election of a new pope is a rigorous process and conducted through a secret ballot.
Relying on the work of God, the Holy Spirit, that will enlighten us, drive us to be able to make decisions that will be good for the church, and that is also through the inspiration of God to us, those of us who will be participating in that election.
In the Ivory Coast, some Catholics say it's now time for an African pontiff.
So for the next pope, my greatest wish is that he be a black man. If not a black man, then at least be a white man who truly a leader.
Ghanaian Cardinal Peter Turkson, Democratic Republic of the Congo's Fridola Ambongo Besungu, the Archbishop of Kinshasa, and Ivorian Cardinal Ignace Bessi Dogbo have been viewed as potential successors from Africa. According to church records, 3 cardinals from the continent have led the Catholic Church in the 2nd, 4th, and 5th centuries. But that was more than 1,500 years ago, in a region where the Catholic Church has been growing rapidly, according to the latest figures published by the Vatican. They show that in 2023, 20% of the Catholics globally were in Africa, and 9 million new worshippers were added the previous year. While Africans continue to root for a black pope, the ultimate decision as to whether the Catholic Church will be led by an African or not lies in the hands of the 100+ cardinals who are meeting in the Vatican to cast their vote. Lara Kulcharslan, Africa Matters.
That's our show this week. Share your thoughts and suggestions about the stories you've seen on this episode, or ideas on what you'd like us to cover on YouTube or on X using the hashtag Africa Matters. Thanks for watching, and it's goodbye from me, Grace Kuria Kanja.